Hello, everyone. That's once again Vincenzo Piccolo from Dermatology Unit of University of Campania Luigi Vanvitelli. And today I'm going to present you another very interesting phenomenon that we observed in relation to COVID-19 and COVID vaccine, i.e. two cases of unilateral periflexural exanthema. We recently published this paper on the Journal of European Academy of Dermatology and Venereology about these two very interesting cases, apparently different from each other, but we will go in detail and you will understand that probably they represent two different phases of the same phenomenon. In particular, we observed this unilateral rash, peripheral rash, occurring in a pediatric and young adult patient. The young adult patient, the case number one, that I will show you later, is a 24-year-old woman, otherwise healthy, who developed after the second dose of vaccine, 40 hours after the second dose, this unilateral asymptomatic rash, while the second case is an infant, a 1-year-old female child who developed this very similar reaction in association with COVID-19. She was isolated with her family after a positive nasopharyngeal swab for SARS-CoV-2. These are the two cases. On the left, the young woman, as you can see here, on the left side of her body, she developed this papular eruption characterized by this unilaterality. And it's very striking example of unilateral periflexural exanthema. On the right here, you can see the back of this 1-year-old baby, characterized by the presence of the same eruption as the girl you see here on the left. So two different patients with the same eruption, probably associated, one to the vaccine, the other one to the virus itself. I tried to resume all the features of these very interesting cases in these slides. First of all, we can speculate that both COVID and the COVID vaccine may induce the unilateral periflexural exanthema. We know that it's a rare but possible cutaneous eruption. We see usually, and the name for this eruption in children is asymmetric periflexural exanthema of the childhood, and it is usually secondary to viral infection. We see it as a probable manifestation of the HHV6 infection in very young babies. But we can't talk of asymmetric periflexural exanthema of childhood in adults, so we preferred to use the term of unilateral periflexural exanthema that is probably the same expression of a similar disease, probably induced by more than one virus, including SARS-CoV-2 infection. We should be prepared to recognize it because it's unusual, but the unilaterality and the involvement of at least two periflexural areas may be very useful tips to remind you the existence of this very unusual but characteristic rash. And how can we explain it? Probably there is a post-zygotic mutation leading to a major reactivity of one side of the body. So one side of the body is immunologically different from the other side, and this could explain why the rash appears just on one side and spares the other side. No treatment is needed, please, just symptomatic treatment if the patient is itchy, and patient's reassurance, parents' reassurance plays a key role in the treatment of this condition that can last also for weeks. Thanks for listening.